Primary aldosteronism with mild autonomous cortisol secretion increases renal complication risk by Katabami et al. Background: excess aldosterone has been shown to promote renal inflammation, fibrosis, and podocyte injury, leading to renal impairment. Similarly, cortisol excess, even subtle increases, have been linked to renal dysfunction. The aim of the study was to determine if the concurrence of mild autonomous cortisol secretion, or MAX, and primary aldosteronism, PA, increases the risk of renal impairment. Methods: 1,310 patients with PA underwent the 1 mg dexamethasone suppression tests. This group was then split into MAX versus non-MAX. MAX was defined as the failure to suppress serum cortisol concentration to less than 1.8 micrograms per deciliter. The prevalence of renal complications were then compared between the two groups. Results: patients with MAX and PA had double the prevalence of proteinuria with lowered GFR compared to non-MAX patients. The rates of prevalence of both lower eGFR and proteinuria increased with increases in post-DST serum cortisol levels. Patients were stratified into 4 groups according to the presence or absence of MAX and the median plasma aldosterone concentration. Patients who had MAX and higher levels of PAC were 3-fold more at risk of having a lower eGFR and a 6-fold more at risk of having proteinuria. Conclusions and implications for patient care. MAX is an independent risk factor for renal complications in patients with PA. These patients will require more intensive management of risk factors such as plasma glucose and blood pressure. Additionally, they may benefit from cortisol suppression methods such as adrenalectomy. Thank you for watching. To find out more, please click the link in the description box or scan the QR code.